Around 6 months ago, I was diagnosed with bipolar disorder. You may be asking yourself, what's the big deal about that? It's just mood swings. But it's not. It's way more than that. Me understanding what bipolar disorder is has changed my life. I used to be a person that would make jokes about it, like, oh, that person's bipolar, oh, they're having their mood swings. But it's way more than that. So today I'm going to be expressing to you what bipolar disorder is and the types, the risk factors, and the treatment plans. So, according to the National Institute of Mental Health, bipolar disorder is a mental disorder that has unusual shifts in your mood, energy, activity levels, and ability to carry out day-to-day tasks. Now, in order to understand bipolar disorder, you have to first understand what mania is. So, mania and bipolar disorder is when someone feels an extreme high, such as feeling overly confident, having loads of energy, but it can also be extreme impulses and reckless decisions. So people have often said that even during their mania, they feel immortal. People have wanted to jump off bridges and buildings because they feel like they can't die. It is different for everyone, mania is, but that's what mania is. So, now that you know more about what that is, I will be discussing the 3 different types of bipolar disorder. Bipolar 1 is where you have manic episodes that last at least 7 days, and then you have depressive episodes that last at least 2 weeks. Now, the mania for bipolar 1 can lead people out to being hospitalized. Like I said, though, it's different for many people, but also if you're like me, you would have mixed features, and this comes with bipolar 1. So that means that I have mania and depression at the same time. It can get very confusing because I can feel like super depressed, but I have a lot of energy, and it's confusing. Sometimes I can't sleep. I stay up till like 4 in the morning, because of my mania, but I'm depressed and I feel like laying down. So that's just an example. Now, bipolar 2 is a little different. With bipolar 2, people often experience hypomania and depressive episodes. Now, hypomania is not the same as mania. It's not as severe. In fact, a lot of people say that they look forward to having their hypomanic episodes because they just feel like, enthusiastic and happy about, the way life is going and stuff like that. So that's not always the case for everyone. Hypomania is different as well. So just to keep that in mind. The last type of bipolar disorder is called cyclothymic disorder. And that is when people have periods of hypomanic and depression over like the course of 2 years. The symptoms aren't as severe, but it's still a bipolar disorder. So let's talk about how I got bipolar disorder. Well, we don't know how. We don't exactly know what causes bipolar disorder. There's many different things that can. According to the National Institute of Mental Health, some studies indicate that the brains of people with bipolar disorder function differently than people that don't have it. So there are also a few risk factors that can put people at risk of being bipolar. So first, if somebody in your family, like immediate family, is bipolar, then you have more of a risk of being bipolar. Say your mother has it, genetics, There's also trauma, a death in the family, stress, that can also cause it. And then the last would be alcohol or drug abuse. For me, I got bipolar disorder, most likely what my therapist thinks is from trauma, but it can happen a lot of different ways. So one of the most important parts of being bipolar is finding the right treatment for you. Treatment can help many people. As for me, I have reoccurring therapy, and I also take medication. That is not me saying everyone who is bipolar needs medication. I have seen a huge difference since I have started my medication, although sometimes starting meds can be depressing for people, because your mania goes away. But bipolar disorder never goes away. It's a lifelong illness, and usually episodes of mania and depression still come back over time. It takes time and can really have a toll on you and your family. But now that you better understand it, I hope you can share your knowledge of it with others.